When you're ready.
Hi, good morning. My name is Michelle Maeda, and I'm the pediatric dietitian for the Children with Special Health Needs program. And I'd like to talk to you today about transitioning to adult health. Now, I know a lot of you have heard of this and have probably been thinking, I got plenty time, so no need worry about it right now. But I hope today that I will help you realize that this is not something that happens overnight. It's not like you just call the adult provider, make an appointment, and that's your adult transition. It's a process, and it's actually a process can be started now. My goal today is to highlight the difficulties or the reasons why the transition to adult health is challenging and important, and to share some things that you can start doing today to prepare for it. The first thing I'd like to go over is to discuss pediatric and adult health systems and highlight the differences. So when you look at pediatric and adult healthcare, we all have a PCP. So in pediatrics, that's your pediatrician, and in adults, it could be your internal medicine doctor. Your primary care provider should act as your medical home. So this is where all your medical information resides. And sadly, that's where the similarities pretty much end. In the pediatric visits are family centered. That means, the doctor knows that he needs to rely on the adults and the guardian in order to provide care for the infant, child, adolescent. So it'd be to their benefit to know what's happening at home, what's happening at school, and the social situation, because it'll give them a better overall picture. Whereas adult visits are patient-centered. Basically, the patient comes in, tells the doctor what's wrong, and the doctor makes recommendations. Pediatric visits are longer because they have to gather all that extra information, whereas adult visits are shorter. And I think that you could really see this in the specialty visits. In pediatrics, we have one central pediatric hospital. We have Kapiolani Medical Center. Whereas you look on the adult side, we have multiple. You have Straub, Queens, Palomomi, Paso. With the specialists, we have a few pediatric specialists that service the entire state. So for instance, we have two pediatric gastroenterologists, the stomach doctors that service the whole state, Dr. King and Dr. Lovejoy. And these pediatric specialists are going to be pretty much affiliated with our one pediatric hospital, Kapiolani. When I Googled adult gastroenterologists, the Google result came out with 78 gastroenterologists on Oahu alone, and they may or may not be affiliated with the adult hospital that you prefer. Because we have one central pediatric hospital, we have one central electronic medical record. And when Kapiolani converted over to Epic, I know they put out a shout out to the community pediatricians to see and encourage them to come on board Epic. So if you went to your pediatrician and they were on Epic, they could open your Epic medical record and they can see every specialist visit, all your lab tests, regardless of who ordered them, all your blood tests, all your medications, if you went to the hospital, if you went to the emergency room. Whereas with the adult side, there's multiple adult hospitals, so you can have multiple electronic medical records. And I am not really quite sure how well they talk to each other. So if you have a community PCP, they may or may not be able to see into any one medical record. Now, an exception to this rule is if you do see a primary care provider that is in one of the hospitals, like say Queens, because Queens is part of a system, Queens and Queens West. So those two hospitals readily share medical records. So if your specialists are in one of the, goes to Queens West, your PCP would be able to see it. Same thing with Straub. Straub and Palomomi are part of the Hawaii Pacific Health system. So if you went to Straub for your hospitalization or ER and your PCP is with Straub, they would be able to see that. Now, just as an extra note, if as an adult, your adult child goes to Straub or Palimonyi, those physicians would have full access to your entire Kapiolani medical record, because Kapiolani is also a Hawaii Pacific Health hospital. So those are a lot of system differences, with really the adult system seeming a little bit more scattered, the pediatric side being a little bit more centralized. But that's not the only issue that I wanted to bring to light today. I also wanted to review how adult providers maybe don't have as much familiarity with the conditions that pediatric patients have, and yeah, and the education with pediatric conditions. So sorry. Why this is a big deal. Because just a generation ago, a lot of these pediatric conditions, the therapies that we provide right now that allow them to do so well, were not probably even invented. So a lot of these pediatric patients didn't do so well just a generation ago, with many of them not surviving to adulthood. So there was no need for adult transition. Even within my career, which is actually kind of long, 33 years, patients that I saw in the beginning of my career with certain conditions that maybe didn't do so well, I can see the same conditions now, and they can do very well and they can thrive. And it's not only with medical therapies. The way society viewed individuals with developmental disabilities, intellectual disabilities, has changed drastically within my generation. With instead of institutionalizing these individuals, having them come out and live in the community. And this is pretty recent. I don't know if anybody remembers Waimano Home. Hawaii actually was one of the states who was in the forefront of trying to bring these individuals who were institutionalized out into the community. So when you look at the slide, 1988, to me, that doesn't seem that long ago, in the continental United States, 90% of individuals with intellectual disabilities were institutionalized, whereas in Hawaii, that's about 35%. So what does this all mean? It means that we could have adult providers that have not really had the opportunity to treat or interact with individuals with special needs, either the complex medical conditions, because again, they passed, or individuals with severe intellectual disabilities, because if they were in the institution, they only saw the physicians who went to the institution. And with these rare pediatric conditions, many of the doctors may have only heard about it in medical school. And when you think about medical education and the specialists, pediatric specialists in one area may learn something very different or see very different cases than adult specialists in the same area. And nothing highlights this best as cardiology, so your heart doctors. So in pediatric cardiology, they could see things like hypoplastic left heart syndrome, tetralogy of Fallot, dextrocardia. And these are structural changes in the heart that occur when the baby is forming during the pregnancy. So when the baby is born, these defects have to be surgically repaired. Versus you look at an adult cardiologist, when they go through their fellowship, they may focus on things like coronary artery disease, heart attacks, atrial fibrillation. And these are acquired conditions that occur based on, your lifestyle choices, your environment, and maybe kind of your genetics, like your family history. So wow, when you look at all of these are big hurdles. Was transitioning to adult healthcare always this hard? Yeah, it was. That's why it's been nationally recognized as an issue for at least the last 20 years and has been on the forefront of the agenda for many organizations like the American Academy of Pediatrics. Has it gotten better? I do think so. Over these 20 years, if you look now, there's a lot more collaboration between the pediatric and adult institutions, especially on the mainland. Here in Hawaii, I know Straub and Queens have opened up an adult congenital heart disease clinic. I also know that there have been teachings, like grand rounds. One of the grand rounds that I saw was a on the tsunami of adult patients with pediatric conditions coming to the adult facilities. So what exactly can we do, as individuals and parents? It's not like we can go and bang on the doors of the medical school and demand that they change what they teach. So I do think that we should focus on things that we can do. And the two things that I wanted to review today are creating your medical information hub and practice advocating. So the medical hub that I'm talking about is actually compiling information on your adult child's condition that is portable and readily available. I know in the past, like kind of a long time ago, there used to be classes held to show parents and families of individuals with complex conditions how to make their medical binders. So they had these binders where they would put all their visit information, labs, hospitalizations, all the cards for their providers. But you think about it, right? 15, 18 years ago, you're on your fourth, fifth binder full of information. That would be very cumbersome to bring into an adult provider's office, remembering that the visits tend to be shorter. So you want it to be concise, and you probably want it to be a paper record, because there's not going to be many institutions that are going to allow a foreign flash drive to be stuck into their computer system. So I've kind of put together a few examples of records and resources that might be useful. So the first is your portable health record. If you go on the website, there are lots of different iterations and variations of this. These are summaries, health summaries, that are supposed to provide like a big picture view of your current medical and past medical history. You can go through these are supposed to be done in conjunction with your current providers. So maybe you could kind of download a few and take it to your provider and see which one is the best fit for you. This one right now is the personal health record that was created by Hilopa'a, which is Hawaii's family to family health information network. This one I think is really geared towards individuals of any age, because if you kind of scroll through it, it has the past medical histories do have a lot of adult type of conditions. This one is a medical summary from the Children's Hospital of Philadelphia. If you look at this one, it was created by pediatric neurologists, so it's very much pediatric based. Another resource that I like are your transfer letters. So these are letters that are meant to be done by your current providers addressed to your new providers. So I like it because it's doctor to doctor, and it actually is kind of like a warm handoff, because your current provider is introducing you, kind of explaining briefly what your medical history, medical conditions are. And they end with, I am familiar with this patient. If you have any questions, please feel free to reach out and contact me for any questions that I can help with. This is one that I've created for our adults with inborn errors of metabolism. Again, introducing them, kind of telling them what their condition is, what's the current situation, how they can get into trouble. And again, please give us a call if there's anything that we can help with. So a nice warm handoff. If you could have one for each of your pediatric specialists to your new adult specialist, I think that would be very helpful. I found these, which I like a lot. These are one-page profiles, because I feel that they introduce your adult child more as a person versus as a sum of their medical conditions. The site that I got this from was really nice. I have it in my resources, because they have templates that all you do is you fill in and you can use them freely. So these are just a snippet of certain resources that I think might be helpful. Other things that might be helpful would be always to keep in hand your most recent doctor visit notes, most recent hospitalization, and your most recent lab tests. to go to your new providers. Also, please make sure any legal documentation that is necessary to ensure that you and your family can be part of that medical visit and medical decision making is completed. Put them, staple them together with whatever health information you're going to be providing, so that's there and done. So the second part that I was going to talk about is advocating. Now, when I talk about advocating, I'm not asking you to pound the pavement with a picket sign or to lobby Congress or legislators, but you can if you want to. I'm really just asking you to practice to speak up, ask questions, and to assert yourself as part of the medical team. Because when doctors make recommendations, they make recommendations based on what they know. And no one knows your family, no one knows your adult child or your situation better than you. So if there's any kind of concerns, ask for an alternative. It could be as simple as seeing if a medication or feeding time can change to suit your family's regular schedule, or it could be as big as asking for clarification on the pros and cons of a procedure so you could decide whether or not it's suited for you or not. We, at our Children with Special Health Needs program, we have focused on transitioning to adult health because we feel that these skills in terms of advocating and speaking up and asking questions should not only be limited to parents, right? We also want the children to learn this as best as they could. Starting early and starting simply is key. So this is one of our resources, My Path to Adult Healthcare. And we ask that you just start very simply, having them address the doctor, saying hi, having the doctor say hi back and ask them a question and allowing your child to answer. If they have medications, letting them put their medications in their pill boxes, and then building on skills so that eventually they know what the medication, at least what it's for, like, oh, this pink pill is for my heart, this white pill is for my nerves. We also are preparing for my adult healthcare, which is a quiz that can assess where your youth is in terms of their what they know, and so you can get an idea of what it is that you need to work on. We have also partnered with Teen Link Hawaii. Let me see, I'm going to. Okay. So I'm hoping you can see the Teen Link Hawaii screen. Let me just double check.
Not yet.
Okay. Okay. All right.
Yes, we can see.
Okay, perfect. So Teen Link Hawaii, we partnered with them, hoping to reach a broader audience to add areas on transition to adult healthcare and taking charge of your health. This site is a wealth of information because we would like typically developing teens to also understand how important it is to transition to adult health. Because actually we get a lot of our information from a survey called the National Survey of Child Health. And it gives us an indication of how well we're doing in any one area. So in the area of transitioning to adult health, they broke it down. So children with special health needs, 22% said that they receive services necessary to transition to adult health, which is not great. But typically developing youth, only 16% said they received services to transition to adult health. So please do share these resources. And that's about it for me. I hope this information was useful. A lot of the information that I presented can be found on our Footsteps to Transition website. Thank you very much.